my pleasure and privilege to have you here today. Okay, and it's always a pleasure, and the reason for that is because it's fun to talk to you. And Mr. Kagan, what's the topic today?
First of all, it's a mutual feeling.
Thank you.
So you invited me to talk today about cancer. It's one of the most deadly illness in the world. One of the most dangerous, one of the most well-known and not well-known at the same time.
That's correct.
It's all
I
over
agree with you.
It's all over the places. It's regardless of where you live. Cancer is a topic of the year, topic of the century. It's basically the deadliest illness so far. Unfortunately, humanity didn't find the cure. But at the same time, I know that something could be done to at least try to prevent it, or at least to find reasons how to behave health-wise, not to, so like cancer is cancer. It's very serious stuff.
But what do you think is the most important question you want me to answer?
I want you to talk about roots of the cancer. Why people having cancer? And is it possible at all to prevent or at least to postpone cancer, or it's inevitable? Because it looks like at some point of life of every person, what if I have cancer next month or next year? Should we eat differently? Should we take care of ourselves differently? Maybe it's a stress, maybe it's a food, maybe it's a wrong treatment. I don't know.
Well, there is no single answer, there is no simple answer for this. And the reason for that is because basically everybody is trying to figure out is there any cure for cancer.
Yes.
As per my knowledge, there is not a single person can offer you any treatment, any cure for cancer, and I think there will never be. And here is why. Because cancer, in my understanding, is this it's the result. And it's like a headache. Of course, a headache is sometimes it's benign, sometimes it kills, but the same thing is for the cancer. It's the result. So, and if you are talking about headaches, can anybody find the cure for headache? Probably not.
Tylenol.
No, Tylenol is just bad. It's a quick fix. All right, and the same thing is for the cancer. So there is no cure for headache because of a very simple reason. Because there are zillions of reasons for headaches. You can't get one cure for zillion diseases. That's not possible. The same thing is for cancer.
Listen, you wrote whole book, Fighting Cancer, Beating Cancer. This is a book. So it means you studied this subject a lot.
Well, basically, my standpoint is very simple. As usual, we look and we address the root cause of the problem. And you can't even imagine how many people come to this office and ask me to find the root cause. Do you think it's baseless? No. Let me give you an example. A guy came to my office with terminal lung cancer. All right, terminal.
Probably smoked all life, no?
Listen. So the guy just came and asked to find out the root cause. And he said, Doc, I know that you're looking for the root cause, so I want to know. And I asked you, listen, let's be practical. Why do we need to look for the root cause if you know that it's all over your body? And the guy told me approximately like this. He said that the reason why I want to know the root cause of my cancer is because all my family, they're all overweight, eat junk food, drink alcohol, smoke. None of them has cancer.
Oh, wow.
I don't smoke. I eat the best food in the world. And I'm slim. No smoking, no alcohol, nothing. And I have cancer. So I want to know why.
So that's a very reasonable question.
Yes, it is. And you can't even imagine how often I hear this complaints and statements. You can't even imagine. And let me tell you what happened next. We just did a workup. It was quite lengthy, but what we did find was that that guy practically did not have any digestive enzymes whatsoever in his digestive system.
Wow.
So basically that was the answer, because the guy did not have any nutrients, almost nothing. He was slim. And when he came to my office and I told him that you don't have any digestive enzymes, that's why just food goes through. And the guy was his wife. So, and the wife said that doctor is probably right. And I said, why do you think I'm right? And she said that, see, my husband is eating 3 times as much as I do, but he is slim and I'm fat.
So why he never went to gastroenterology doctor? Why he never checked what's going on, why it's happening? He eats a lot and still so slim. So why he waited till it's cancer? You know?
Look, that's not an easy thing to pick up. Unless you look for it, you won't find it. Just who knows, just the patient comes, it's slim, he is slim, he says that he's following the diet, and this guy was following the diet, yes.
Mm-hmm.
I will tell you later on probably what kind of diet he was on. And that nobody even questions this, because the guy is slim, everything is good. Why do we need to figure out how much exactly he is eating? Nobody's doing that. And that's one thing. The other thing, it is quite difficult to figure out that the guy didn't have any digestive enzymes.
So how did you find?
Well, that's not my achievement. It's just the lab.
But
Just the lab.
What do you mean lab? You did like regular tests like any primary physician, or you did more extensive research?
Well, I don't know about other doctors. That's not my field of expertise what other doctors are doing, but we are using the best labs in the United States. And believe me, the best labs in the United States can figure out about digestive enzymes, about everything.
Wow. But it looks like you were not probably the first doctor he asked
No.
for help.
No, but he was the one, I was the first one who was looking and addressing the root cause of the problem.
So then why did they put all of these fruits and vegetables here? They look pretty, but like, according to you, it doesn't matter. Even if you eat best food and like healthy food and everything,
It
doesn't
does,
matter.
it does, it does.
But
It
not
does.
all the time.
No, that's a little bit more complicated than you might think. Let me finish the story.
Okay, interesting.
Let me finish the story.
Very interesting story.
So I told the guy that we did find the root cause, and that's the most likely reason why he ran into trouble. And I said that I told the guy that I cannot promise him any cure or anything, but at least we can try to give him digestive enzymes, and maybe his condition will improve. The guy listened to me and said, Doc, I understand what you're saying, but the only thing I don't understand is this. I eat the best diet I could find. How come I don't have any digestive enzymes?
And what was
And I told him that the reason why you don't have digestive enzymes is most likely the diet you put yourself on. The guy was vegetarian, strict vegetarian. All right? And as you know, vegetarians, they consume a lot of foods we usually prohibit our patients to eat.
like?
I'm not. Let's talk about not my patient, let's talk about me. I am gluten-free for many years. I'm alcohol-free.
Talking about yourself.
Right.
Okay.
But basically, what I advise my patient is what I'm doing. You know what they say? I do what I preach. Okay? No carbs. Try to stay away from milk. Listen, nobody's perfect. And I'm not perfect either. I cannot say that I'm totally out of carbs. No. Yes. Sometimes I cheat. I'm a human being. I'm not God. But in my understanding,
I occasionally drink a little bit.
you're allowed to. I'm not. Because how can I tell my patients not to drink if I drink myself? I can't do that.
Okay.
No, of course, no smoking, no alcohol, no stay away from carbs. So basically that's what I'm trying to do. And the end of the story was very interesting. So as soon as the guy learned that I believe that the reason for his cancer was actually his diet.
Mm-hmm.
The guy was sitting kind of, not paying too much attention what I'm saying, and I said, just wait a little bit, I'm going to write a prescription. And the guy said, can I go to the bathroom first? And I said, sure. You can go to the bathroom and just come back and I'll give you a prescription. The guy went to the bathroom, I wrote the prescription, the guy's not back. I waited, and I went to a reception area and said, where is the guy? And the secretary said, he left with his wife. He never picked up the prescription. Why is that?
Because he probably decided to change his diet to eat all possible meats and everything.
No. It was more difficult for him to admit that what he was doing for 20 years was wrong.
For 20 years? Wow.
You know that guy who...
and he never came back?
You know that guy who let them to burn him on a stake? Because he said that Georgiana Bruno, what he said, that the Earth is revolving around the sun.
Yes, correct.
So he preferred to die for his beliefs. And the Galileo Galilei, he said, okay, I will agree with those guys and I'll just quit my ETSM, but I will live. And I think that guy, Galileo, was much smarter than Georgiana Bruno, who died. I don't think it's that brave to die for idea. I think it's much difficult to live and fight for it every day.
Interesting.
Yeah, that's basically what it is. And as soon as the patient comes, a lot of them, they ask, what's wrong with me? Why?
So even the lesson from your story is not just treatment, is not just healthy lifestyle, it's not even to find the cure, treatment, or like a reason, but even trying to fight consistently, behave in the right way, I would say, consistency, to do something like which is the right thing to do. It's easy to do one day, everything is fine, but to do it every day is much more difficult. Like you say, once in a blue moon you can cheat, but with your health, but you cannot do it every day.
I strongly disagree, and the reason for that is this. Let me ask you this very, very, very simple question. Do you have a computer at home?
Of course.
You do? Of course. Very good. So, when computer starts behaving strangely, what do you usually do? You reboot the computer, right?
Yes.
You do it
restart,
right? You reboot, restart, right? So the same thing I suggest to my patients. If they restart their system, it can help. What I usually suggest is, if we are talking about nutrition, usually is fasting for about 1 week. It's pretty much enough to restart everything. Like computer, but you reboot computer.
Total fast or just water or little bit something?
A woman, either she's pregnant or she's not pregnant. You can be a little bit pregnant. So say if you're fasting, you're fasting. It's water only.
Wow. Whole week?
I did it myself, come on. Some of my patients, they do it for 2 weeks. I was not that strong, I did it for 1 week, but reboot was very good. Reboot. And that's what it is. And
did you work for that week?
Of course I did.
You worked and you didn't? Yeah. You're a very strong guy, very strong.
I don't think so, I didn't have any option. I just told you before, when we came to the United States, did we have an option to relax and be lazy and relax on the beach? No.
At least for me,
not for me either. So even if I'm fasting, it's not an excuse not to work. I think that if I don't work, I will die. That's my feeling is. So basically, what I'm driving at, a lot of patients, they come and they ask me to find out the problem. What the problem is.
I also know that very often I know cancer patients who became sick after humongous, not everybody like this, but from the humongous stress at work and their lives, etc. I also know, so it could be food they eat, could be stress, and sometimes it's combination of everything. And I'm not talking about like Chernobyl explosion and radiation. I'm talking stress. Very often I see people who are like became sick because of the tremendous stress at work, at home, or both. You know, is it true? Is it possible?
Well, it's like asking me who is first, chicken or an egg. You know, and let me explain. What you're saying is absolutely right. But the reason is why people are perceiving their lives as a stressful life, and the stress is enormous. Why do you think, why does it usually happen? And in my understanding, from what I see, not what I think, but what I see, and it's most of the time it's confirmed by labs. The reason for this is very simple. As you know, that in order to fight stress, we need a stress hormone called cortisol. So if there is enough cortisol, adrenals, cortisol, you have heard probably about that, right? If there is enough cortisol, we are not really, we don't perceive a stress like a something really important, because we have we have something to fight. But what if a person does not have enough cortisol to fight everyday stress? Then it becomes a problem.
How to improve
Just like
volume of cortisol?
No, the thing is that in order it's improve.
Yeah, what to do to have it more?
Improve, you know, it depends what your goals are. You know, some people get the cortisol in pills or in injections, they feel wonderful, but the payout, the price they pay is very high because they damage their bodies. Yeah, so basically, what is the reason why adrenals are down and people do not have enough cortisol? Very simple, because they have some kind of chronic inflammation or some problem that drains their system for years. In order to bring your cortisol down, you need years, even decades. Cannot be done in one day.
So, and why it's for years? What? Wrong nutrition, wrong lifestyle? Why?
It depends. It depends. Zillions of reasons. Most common, there are three. Sinus infection, teeth, and digestive system. So that's most common ones. Okay, supposedly somebody has allergies. Well, but allergies is inflammation. What do you think? That it's that benign? I don't think so. Because it's still inflammation, drains your body no matter what you do. Teeth. I remember the lady who came to my office. I think she was 21, something like that, and actually her mother brought her and said, "My daughter cannot attend college because she is always tired. She cannot get out of bed. Doctor, please help." And I helped her right away. When she opened her mouth, I just did some investigation and realized that she had an abscess in her mouth. So she went to oral surgeon, the abscess was drained, she was back to college.
Wow.
As simple as that.
So it was teeth, had nothing to do with anything else. Wow.
No, it's just inflammation, any inflammation. I'm just giving you an example. You know, a lot of patients, they have parasites. And you cannot forget about parasites because in New York area you can get any parasite from the world. I had a patient from Long Island who never traveled outside the United States. When we tested him, he had parasite, and quite dangerous one, and the Department of Health called me about that. That's life, especially in New York.
I wanted to come back to the topic of cancer because the most popular, not popular, nothing is popular when we're talking about cancer.
Right.
Most known, most used treatment from cancer all over the world is chemotherapy and radiation.
Right.
And listening to you more and more, I realize that it's not always the best options.
Well, everything is, you know, there is no perfect treatment. Some of the cancers, they are treated by chemotherapy very well. And we cannot deny this. But the thing is that not everybody knows there are so-called secondary cancers. Have you ever heard about secondary cancers?
You mean after the treatment, after person?
Because of the treatment. Yeah.
You mean side effects?
like side effect another cancer.
No, I never heard of it.
Well, that's very well known thing after radiation because that's the way it is. And it's a very common situation. I just had a patient who came to me and that lady started having tumor in her sex reproductive system. And she was cured, but guess what? In a few years, she got another cancer on another location, on her skin. And then she started thinking, how come I had a cancer in my reproductive system, then it's my skin, or something wrong with me? She came to me and said, Doc, I want to know why. That's what they usually ask. The answer was quite simple. Actually, I figured it out from the first blood test. Yeah, her B12 level, vitamin B12, was very low. And what happens is that somebody doesn't have enough B12. B12 is responsible for DNA repair. What happens if you don't repair your clothes, your car, your apartment? What will happen? It will break down, right?
Correct.
That's what will happen.
It'll be broken, yeah.
So if somebody doesn't have enough vitamin B12, it's responsible for so-called methylation, and methylation is necessary for repair. What will happen to DNA? Eventually, nothing, just will mutate, there's no repair, and that's it.
Do we have B12 in any of these fruits or vegetables?
Not enough
Carrots?
not enough to support that. B12 is a different animal. B12, we have enough B12 in our diet. The problem is absorption. People who doesn't have enough B12 in their bodies, they usually are not suffering from low intake of B12. They are suffering from inability to absorb and digest. Yeah, listen, I made this mistake many times. I thought that as soon as I put it in my mouth, or my patient puts something in my mouth, it's going to be digested and absorbed. No, this is not the case. If digestive system is not working properly, it doesn't matter what you eat.
So what did you advise her?
I'm sorry?
What did you advise this lady to do?
It was a workup. It was a workup. We figured out, we did the digestive system test. We just picked up something and they put that lady on an appropriate diet, I think was appropriate. And she's doing pretty good right now.
By the way, another myth, I don't know myth or not, but I saw many times after surgeries, after when people like with very low immunity, etc., including cancer patients, they're in rehabilitation centers, sometimes in hospitals, they say, drink Ensure, it will increase your, improve your immune system. Is it true or is it also a myth? I don't know.
That's a difficult question. That's a difficult question.
And so many times cancer patients
as per my understanding, as per my knowledge, most of oncologists, some of oncologists, they advise carbohydrates and basically the sort of carbohydrates in Ensure. There is some kind of good thing in it. And in my understanding, it depends what kind of cancer patient has. And here's why. 70% of immune system is located in the digestive system. So supposedly somebody has, God forbid, cancer of his colon, and a lot of the big portion of colon is resected. So what will happen to his immune system? Most of it is gone.
So I definitely...
that's a good choice because you don't have any other options.
Yeah.
Because when a patient comes to me and says that most of his digestive system is removed and has to help, I say, listen, I can give you some kind of immune system support in like vitamin C infusions that you can give, but other than that, there is not that much we can do. Or somebody who comes with after stomach issues, stomach surgery, or somebody comes with the bypass surgery. I stopped taking those patients because that's not that much I can do. You follow me? That's why in this...
I know when people have brain tumors sometimes after surgery, they drink it, I see it pretty often. Especially cancer patients.
It depends. And the reason for that, as per my understanding, Ensure works best when there is a problem with the digestion. So if somebody cannot do anything, let me ask you this: how many patients can go gluten-free, stay alcohol-free? Huh?
For how long? For how
For
long?
life.
No,
Not that much.
Not so
right?
much.
Not so many, right? Not so many. And the same thing is here. Do you think that all patients who come to my office follow my advice?
No.
The insurance probably is good for those who just can't do that.
Mhm.
And it's not their fault. It's not their fault, believe me or not. And I just a quick, just a quick piece of information. See, in our gut we have beneficial bacteria. So by genetic material, there are 10 times as much as we are just like humans. They have genetic material 10 times as much as we do. So who is the boss? Sometimes I don't think I am. I don't think I am sometimes in some of my vision really, because the bacteria in our gut dictate what to do. Do you think I'm crazy? No. The explanation is very simple. Supposedly, a patient has a bacteria that eats carbohydrates, like yeast. And as soon as the patient drinks this, ensure what will happen. It will be digested, consumed by the bacteria. So what will happen to the sugar of the patient? It will go down.
Yes.
And what will the patient do? He will eat more and more and more. And nothing he can do, because of a very simple thing. He cannot bring his sugar up by
Himself.
by his thoughts.
Yeah.
There is no way, I'm telling you. In order to get out of this, you need to kill yeast first.
This book, you can just get it in your office, or you can sell
No,
it.
you can buy it on the internet, you can buy it on Amazon. Okay, basically what this book is about.
Yeah.
It's just kind of review of alternative cancer treatments. And that's, some of them, and most of them, are not what I believe in. Because I believe only in what I learned, what I have seen, and what I think is right, what is working. Not everything, and most of them, that's the review of what they're saying. Okay, what I believe personally is that very simple thing: just look for the root cause. Okay, the only thing that I use to support immune system is intravenous vitamin C. It was a long time. It is not recommended by the FDA or any government organizations. Even though we have a couple of studies saying that who has high doses of vitamin C in cancer patients. And guess what? A little while ago, the guy called my office and asked if we are doing vitamin C infusions, and I said yes. And I asked the guy, how did you hear about that? Who advised to do vitamin C? And the guy said, you know what? I am under treatment in NYU. And they have a trial for IV vitamin C, I just couldn't get in. So my oncologist advised me to look for other doctor outside NYU to get vitamin C, which is on trial right now.
So you're saying you're not alone thinking that intravenous injection of vitamin C could be helpful?
It can support, once again, it is not a cure.
No silver bullet, I understand.
It's
no crystal ball.
No, it's not a cure, it's not a treatment.
But it is a possibility.
Support.
It is a possibility.
It is a support. And right now, just why don't you go to any government, say a National Cancer Institute, and look for vitamin C. And that's what I'm saying. 2 studies saying that IV vitamin C improves well-being, but it's not recommended.
But it's in addition to chemotherapy and radiation, or instead, or how does it work?
Everybody is different.
Uh-huh.
You know, everybody is different. So I have a patient who came to me 2 years ago. The guy came with disseminated prostate cancer all over the body, in the bones and everywhere. So he did. He didn't tell me all the treatments he got, but we were providing him support with vitamin C. Now he's still coming to my office. 2 years later,
Got it.
right?
I got the point.
No pain, no weight loss, sleep is good, appetite is good. All right?
That's already achievement, big achievement.
Well, I'm not sure that's vitamin C alone. He is doing a lot of other stuff. But see, you know, every patient is different. Not everybody, by the way, not everybody can tolerate it.
Did he change his lifestyle dramatically, food or any diet? Or is
He said he is gluten-free. That's the most important thing. And also, always patients are asking me, doctor, what I can eat? And my opinion is very simple. It's not about what you can eat. It's about what you can't eat.
like what you can't eat?
Like what I don't eat. I'm gluten-free. I'm
Oh,
alcoholic.
okay. Then,
I don't smoke.
what about small piece of cake?
Well, listen, nobody's perfect. You know, I'm not even applying to a God's position in New York State or in New York City. I don't know if it's vacant or not. No, I do not want to even to pretend that I'm not that. Listen, I don't know everything. And you know, if I don't know, I'm telling you honestly, I don't know. You know that, right?
Yes.
So you cannot pretend that I know
The only criticism I heard toward you is like you're way too honest. That was the only criticism I heard from patients. Why he is telling us the truth right in our face? Could he a little bit make it more soft, you know, like not too like straight in your face?
So look,
Sometimes it's for people. Sometimes it's too brutal.
Sometimes I think they're right, but see, in other way, it's good because as soon as they don't like the truth, they cut out, and it's kind of, you know, we just get the patients are just like telling you that it's not for me. Not everybody can do it. Not everybody, and because my belief is that the best doctor for himself is not me. I cannot cure a patient if he doesn't want to be cured.
It's true. Nobody can.
It's his job. You know, I can only help and guide, but most of the work burden is on the patient. That I know that that's not what you want to hear. I know that.
That's yes.
But that's what I stand for.
Okay, one more question. So, first, look for the root cause of the cancer.
Right.
Second, if you, God forbid, have cancer, try to change your diet, try, of course, health lifestyle, of course, go to the right doctor. And I'm not saying Dr. Kalitenko, but a right doctor. And try to follow doctor's advice, not just like ignore it or prefer like to ignore the truth. But there are also miracles, rarely, but miracles sometimes. Like I meet people who overcame cancer, and when everybody said it's impossible, you know, like it's also psychological, you know, like how person feels like ready to fight or like impossible, you know, like sometimes it's even psychological, you know, like how person perceives the threat and the danger. If person is ready to fight, it's not always possible, but sometimes people survive cancer only because they truly believe in their heart they will overcome and they do everything possible, trying every treatment possible in New York and all over the world. Sometimes people are ready to travel, ready for sacrifice just to overcome, and often they're successful because they're like ready to fight.
Right.
Psychological. I'm talking.
Yeah, that's definitely true. However, see, in order to get any opinion on just that, because you mentioned that some people overcame cancer. In my understanding, there is no clear-cut just difference between. We cannot just say that person or treatment overcame cancer, and because of very simple thing.
Can come back. That's why.
I'm sorry.
Because cancer can come back.
No. No, that's much more complicated thing. There was an interesting story. A few months ago, in Britain, you know, there is a government system. So there was a computer glitch. And a lot of women did not get the follow-up letters to repeat their mammograms. So there was a kind of scandal. And actually there was a letter signed by a lot of scientists saying there is no problem with the mammogram. And the reason for this is because what they're saying is very simple. When somebody, supposedly a woman, is diagnosed with a breast lesion on mammogram and they biopsy it, and they diagnose this lady with cancer, it doesn't really mean that this lady has cancer. Why is that? Because the biopsy is just some kind of stuff we see and we believe is cancer, but may never become a cancer. Did it occur to you?
No.
Oh yeah. Oh yeah. And that's why they were saying that, this mammogram is not that important as you might think, because what they do, they find the lesion, put a needle, call it cancer, remove it, and of course nothing will grow. But nothing will grow in the first place. But they just declare it as a cure for cancer. And say, do mammogram, we saved lives.
But everywhere I read before, that's the first time I hear it.
No, I just...
Everywhere is mammogram saving lives. And promotion everywhere, how important it is.
Mammogram is one of the most probably, questionable, debatable thing. And let me give you another example. Have you ever heard about prostate test PSA?
No.
No? PSA, for prostate cancer.
Okay.
Yeah. Okay. It was used, declared very useful, etc., etc. Now they have to admit that this screening test does more bad things than good, because they overdiagnose. Let me tell you something. By statistics, about 40% of men after the age, or either 50 or 60, I don't remember that, have histologically prostate cancer. 40%. The question is, how could it be? It's not. It's just because they do a biopsy, they see something, they interpret it's a cancer, but it doesn't really mean it's a cancer. You follow me?
So you're expressing doubts about some, again, well-known tests.
Why don't you do this way? Just do me a favor. When you go home, I know that you are a very busy guy. When you have just check about that scandal in the Britain about the mammograms.
I will check.
Yeah, and there is a letter. Basically, it's a lot of people there saying.
Okay, well, we have to wrap it up. So, what is your I wouldn't say advice, but recommendation to people who are not at a stage of cancer yet, but who can do something, not to prevent cancer, but at least to feel better listening to you and trusting your judgment, what could be your recommendation?
Very simple, go back to nature. I had a lady and my patient, and she had a grandmother who was diagnosed in the United States with severe diabetes. She was given a lot of drugs, injections, etc., chem strips, etc., etc.
Nothing worked.
So, no, the lady did very simple thing. She just threw everything out. She went back to Haiti. She was born where she was born, and she started eating the same food and doing the same thing that was she was doing when she was a kid. Guess what happened with her diabetes? It was gone. As soon as she got back to nature, she started eating fruits, vegetables, fish, what natives do? Gone. That might be.
Sounds
go back. Of course, I don't say that there is we can support with the immune system with vitamin C. We can look for the root cause. It's also very important. But every patient has to figure out his own route, his own way to do it.
And exercise too?
Well, cancer patient, it could be dangerous.
Yeah, for cancer.
Because but going back to nature, I don't think anybody will argue with this.
Yes.
There is not an advice. I'm not giving you any medical advice because every patient is different. But what I did for myself and what I advise my patients. My pleasure. It was pleasure to talk to you.
Thank you.
And
I hope it was valuable and informational. I'm sure our viewers learned a lot. And again, there is no cure for everything, but we can try. Back to nature is a good advice.
let's wrap it up because I want to eat this.
Okay. That's after the program.
Okay.
Okay.
Thank you.